Ladies and gentlemen, the amateur sommelier is back with a quicker wine lecture in this video. That's not really so much a wine lecture so much as you can see the lack of actually drinking alcohol, and you can still be drunk. Now, we're going to be going over a couple things as to how on earth I came up with this wine lecture, but we will start with some objectives. We're going to identify the patient of interest in this particular case that I'll be describing. We're going to describe the risk factors associated with auto-brewery syndrome, identify the recommended tests to diagnose auto-brewery syndrome, and explain the legal aspects stemming from the auto-brewery syndrome. So we'll start with our case study patient. He's a 33-year-old male, and he was enjoying his scrumptious meal of shrimp and rice noodles that were, I guess, quote, seasoned, more like marinated, with Thai peanut sauce, soy sauce, and lime juice. And there was absolutely no alcohol involved in the creation of this particular dish, as this particular person actually has not had alcohol since the 19th of July. Very interesting. So while he was enjoying his leftovers while at work, he began to notice extreme fatigue, dizziness, like he was hungover after drinking an entire bottle of wine, which makes no sense because he was at work, being very weird, and eating leftovers, and telling people to go to bed all the time. It's a very weird individual. So, as I said, no alcohol consumed. So the preliminary diagnosis is carbohydrate overload because his GI appointment is in September because he couldn't get anything earlier. Such is life. And he decided to do a very interesting Google search while I was at work. That was the same as the title at the beginning, Can You Be Drunk Without Drinking Alcohol? And such did he find auto-brewery syndrome. Now, I've been talking so long about this patient, and now it's time to reveal who he actually is. Oh dear, that photo is terrible. That looks a lot like me for some reason. I can't imagine how or why. Meh. So, what is auto-brewery syndrome? It's also known as gut fermentation syndrome. In essence, the microbiota in the gastrointestinal tract, the mouth, and even in the urinary area, if you could believe it. Those altered microorganisms are able to ferment ingested carbohydrates to produce alcohol, which is absorbed to the bloodstream, and guess what? You feel drunk. Among these, we most notably know of the fungi. They are mostly well known for making alcohol because we use them to make wine. Okay, most of those Canada species there, we don't. But the Saccharomyces cerevisiae, very well familiar with. We also use it to make bread. Just saying. There's also, as far as I could find, 2 species of bacteria as well, including Klebsiella pneumoniae and Enterococcus faecalis. And there are also several risk factors at play of contracting, if you will, auto-brewery syndrome, including long-term use of antibiotics and antacids, like me. Several comorbidities, including diabetes, fatty liver, or non-alcoholic fatty liver disease, GI disorders, that includes Crohn's disease, irritable bowel syndrome, small intestinal bowel overgrowth, and there was even one case I found where even COVID can help you contract the horror of auto-brewery syndrome. I know, I couldn't believe it either. I may or may not have used it as a source. Cough. Genetics. So if there's a genetic predisposition, that also is a problem. And most of it is mainly diet. There are too many carbohydrates and too much sugar. 2 things I love way too much. Go figure. So clinical presentation, mainly you just look intoxicated. You look drunk. You look like a Joshy after he decided to go to the bar and drink way too much alcohol when he was supposed to be to work. Yeah, Joshy, you just got called out. You're welcome. Go back to work. These include and are not limited to seizures, slurred speech, blurry vision, memory loss, faintness, uncoordinated motor skills, emotional distress, or aggression, even when you don't drink alcohol, which is so tragic. I mean, at least get, like, something that tastes good, beer, wine. Anyway, since most of these are non-specific symptoms, frankly, it is difficult to diagnose. You need to rule out other GI or psychiatric disorders, like drinking too much, like Joshy. We're not getting over that. We're not. So, if you land yourself in the ER or at your doctor's office and they want to do lab testing, they start with the basics. Complete blood count, CBC, comprehensive metabolic panel, CMP, ethanol level to see how much alcohol is in your bloodstream at the moment, especially if you're in the ER and you just, had a high carbohydrate, high sugar meal and you're very agitated and everyone around you is like, what is this person doing? They'll also do a urine drug screen just to make sure there isn't any other drug abuse going on, just to make sure it's actually the ethanol in question. You can attempt to do stool testing. I'm going to tell you good luck, and not just because of the smell, although that's about a good 75-80% of it. There's going to be a lot of bacteria and fungi that you're going to have to attempt to isolate into their own colonies without contamination. Because let's face it, there's a lot of bacteria and fungi in the intestinal tract. Have fun trying to isolate specific organisms there. And as well, there are actually small amounts of fungi in the lower GI tract, and that's considered normal. So have fun with that nonsense. The non-invasive diagnosis test of choice is going to be what's called the carbohydrate challenge test. Some people call it glucose tolerance. It's when you fast for 8 hours beforehand, but you're also going to be abstaining from alcohol for at least 48 hours. Make sure there's absolutely nothing there, because they will be doing a baseline alcohol and alcohol metabolite level testing prior to giving you your lovely glucose drink. I would not recommend having to do this because that drink allegedly tastes terrible. I mean, so I've been told. Never had to do it myself. Although, I don't know. May think about it. Next month. We'll see. And then they're going to do blood draws for alcohol levels at specified intervals for up to 24 hours. Literature, they usually start blood drawing at half an hour. And then they go anywhere between 1, 2, 4, and 8. Or they can do every 15 minutes until the alcohol level goes to 0. Good luck getting it down to 0. And then, of course, there is the unfun invasive diagnostic testing, which is going to be the colonoscopy or enteroscopy, which means putting you under. You have to do special preparation for those tests. It's very unfun. And the plan is to obtain gastric, small bowel, and or colonic fluid aspirates and test for any pathological bacteria or fungi. And it's gross. It's very gross. Don't do it. So we have, for treatment and also management, obviously dietary adjustments are going to be needed. As far as I could tell, you could still, in theory, drink alcohol. They did not mention abstaining completely from alcohol or avoiding it altogether. They did say you're going to have to go to low carbohydrate, low sugar, and high protein diet. I have a very good feeling, though, they'd be like, why are you asking if you can drink alcohol if you have this? What's wrong with you? Who even are you? After that, if they find the bacterial or fungal agent that is causing part of the problem, they will give you the appropriate antibiotic or antifungal, and then you'll need to go on a daily probiotic afterwards to make sure that the pathogen of interest does not attempt to grow back and then overwhelm the GI tract. And you may even need the horrible, disgusting thing called a fecal microbiota transplantation. And I will save you the horror of describing that. You may kindly go look that up yourself, especially if you are watching this while eating. That is going to be a fun Google search. Save it until after you're done eating. Frankly, 2 hours after. And then there are legal aspects to this. So what happens if you are driving your car and there's a crash? There's erratic driving behavior. A cop finds out and it's just like, hey, this is a little bit sussy baka. What's going on here, buddy? And then you insist, I have drank absolutely nothing. And then they find out that your blood alcohol level is dangerously high. And so, there are legal cases. And that's actually one of the new angles that defense lawyers are allegedly using, is that people actually have this condition to try to get their clients a lesser sentence. Does it work? I couldn't tell you. That is not the point of this presentation. Joshy, don't try it, because I know you will. There are also employment problems, poor job performance, and people think you're intoxicated on the job if you have this condition. And that's just tragic, because you didn't even get, the imbibing done. It's so sad. This obviously leads to strained relationships, both professionally and personally, because people think you're a closet alcoholic. And you may not actually be a closet alcoholic. You may just have this syndrome. And, you could just check their finances and see the last time they went to the liquor store. Although, I don't know if they give that over willingly. And no, I'm not advocating for hacking their financial records to do that. Because I feel like Joshy would try to do that for other nefarious means. Have we mentioned that Joshy should just be going back to work? Joshy, go to work! And so these are the sources that I, in fact, used to make this quick and sort of painless presentation. And where is the one about... Oh, the last one is the one that I found the COVID-19 thing for. That was incredibly fascinating and also incredibly short, if anybody wants to go ahead, look that up and read it. So, thank you all so much for watching my brief wine lecture presentation. Hopefully it's actually brief, because I'm not going to lie, I can't see my camera screen to see how long this is actually going on for, so this is hilarious. Oh wait, I didn't actually record the background at all, and I just did this entire presentation. You have got to be kidding me. This is going to be fun to actually do. So, let me do a little bit of stuff here. And then, yeah. This is going to be really fun to edit. And I will see you guys on the next wine tasting. Bye, everybody!